Yes, the testing station is closed now, but we learned today that one of the many obstacles that officials in the city have had to face was that they were actually going to move the testing station to another city, even as they were seeing numbers going up. The Director of Public Health also told us that on June the 9th, he actually informed Public Health England that they could see a slight problem and he asked for some help. 2 weeks on, or 2 weeks ago, they were sitting round in a meeting at the town hall with the mayor, and suddenly they heard the Health and Social Care Secretary, Matt Hancock, at the Downing Street press conference stand up and say there was an outbreak. The mayor told us there was a collective dropping of jaws because that was not how they were seeing it. And they weren't seeing it as an outbreak because they had not been given the data.
They can play tennis, but they won't be able to quench their thirst in the pubs this weekend, unlike the rest of the country. They haven't quite put up the barricades, but Leicester is in lockdown. A somewhat chastened mayor of the city, who yesterday spoke of his frustration with the government, today accepted it was a sensible move.
What we got from the Secretary of State last night was, I think, more wide-ranging than we'd anticipated. And I'm really grateful for that, because while it is a pain for us and a nuisance for us in the city to be subject to that level of restriction and to have the clock, as it were, turned back in the development of the virus, it is nonetheless something that has some realistic prospect of being effective.
This red line marks the postcodes highlighted in the outbreak. It's not just the city itself, but other districts where they have identified cases. So Leicester's lockdown means all non-essential shops should have closed today. Schools will close from Thursday until September, except for key workers and vulnerable children. Pubs, restaurants and cinemas will not reopen this weekend. Travel to, from or within Leicester should be avoided unless essential, and the relaxation of shielding measures for the most vulnerable won't go ahead next week. The numbers are stark. 10% of all positive cases in the country over the past week are in Leicester, and admissions to hospital are between 6 and 10 per day rather than around 1 a day at other trusts. But this is data Leicester's public health officials have only just been given.
What's happened here in Leicester has shone a spotlight on the serious flaws in the testing system that's been set up in this country, and it all involves the data. For weeks now, directors of public health have been complaining that they are not getting the granular detail that they need. They weren't being told postcodes, street addresses or ethnicity, all of which they needed in order to identify, to pinpoint those clusters and those outbreaks.
And Leicester's public health director is completely open about how much it hampered their efforts.
I think it was extremely frustrating. I think that we spent a lot of time asking for that granular data because obviously the situation you want to be in is to be ahead of that, where you're starting to see the rise so that you can intervene at that point. And we just didn't have that.
Today, the Health Secretary acknowledged it was difficult for the city, but said these measures were necessary.
We've been putting in place measures in Leicester for some time now, but it was clear that we needed to take this further action. Look, I understand for people in Leicester how difficult it is, especially when the rest of the country is seeing the lockdown measures lifted, that they are going to be asked to stay at home for that much longer. But it is profoundly in the interests of people in Leicester and across the country that we get this virus under control.
There will be questions at some point about whether the test and trace system should have alerted them earlier, but for now the fact is Super Saturday, the further easing of lockdown measures across England, is cancelled here.
So Victoria, how will this lockdown really work? How will it be enforced?
Well, Mr. Hancock now has to sign some regulations under the Public Health Act, which will exempt Leicester from the easing of the lockdown. But probably some good news for the businesses of Leicester, that the government has now said that employers who are forced to shut their doors and who had previously signed up for the furlough scheme will be able to re-furlough their staff.
Victoria, thanks very much. We were hoping to ask the Prime Minister about the lockdown at his speech in Dudley today, but space for journalists was limited and we weren't invited. We also asked for the Health Secretary to appear on the programme tonight, but we were told he was not available. Despite numerous requests, Matt Hancock has not given an interview to Channel 4 News for more than 3 weeks. However, a short while ago, I did manage to speak to the former Health Secretary, Jeremy Hunt, who's now the chair of the Health Select Committee. And I started by asking him whether he backed the local lockdown introduced in Leicester.
Yes, I think this is obviously very, very tough for the people in Leicester. But it's infinitely better that we have a system where we know exactly where the virus is and we lock down those areas without the whole country having to go into hibernation. So this is the system that has been used in places like Vietnam and Thailand and to a lesser extent South Korea, where you use track and trace as much as you can to contain a virus, but as a last resort, you might have to lock down a whole city.
The fact that we've reached what you've described as a last resort, does that suggest that test and trace isn't working as effectively as it should be?
Well, we are unique because we are introducing test and trace at a stage when community transmissions of the virus are still running at over 3,000 a day. So that's why it's going to be trickier to get it to work. But I do think it's the right approach. I just think we should go further.
You say it's going to be trickier. Is it actually impossible when transmission is running at such a high level? I mean, you were quite kind describing as unique. That's our unique problem, isn't it?
It is. And that's why I think we have to be imaginative with doing things that they haven't had to do in Taiwan and Singapore and countries like that, which is why I think we should have mass testing of NHS and care staff, for example, so that every week or every fortnight, everyone in the NHS automatically has a test, everyone in care homes automatically has a test. Because we know that up to 20% of the people with coronavirus in hospitals actually caught it in that hospital.
And how draconian does it need to be? Because the government seems to be relying on the compliance of the Leicester people. But if people drive to restaurants and pubs down the road from the weekend when they become open, should there be roadblocks set up? Should it be more rigorously enforced?
I can't imagine we'd ever have roadblocks or anything like that. But the advice is very clear for people in Leicester. Stay at home unless you absolutely have to go out. Hopefully it's only going to last for a few weeks because, it must be a nightmare for them having geared themselves up for the lifting of the lockdown on Saturday as the rest of the country has done.
Given that the deaths registered in the UK have fallen below a 5-year average for the first time since mid-March, are these kind of local lockdowns actually overzealous? Is it now time to prioritise the economy? And if you don't, are you going to risk more problems down the line with people's health when they lose their jobs, for example?
Well, it is good news that deaths are now below their long-term average for the time of year. But let's remember what we've been through to get there. 1 in 5 residents of care homes has died because of coronavirus. We've had a horrific death toll. And the priority now must be to make sure that we don't get back to that sustained community transmission. So I think it's going to be stop-go for the next 6 to 9 months until we get a vaccine. And so I'm afraid we're going to have to get used to things like what's happening in Leicester, happening in other places as well.
Jeremy Hunt, thanks very much.
Thanks, Kathy.
So we've heard from the politicians and public health experts. What about the people of Leicester who are having to head into another full lockdown? Darshna Soni is live for us in the city centre. Darshna.
Well, the front page of today's paper, John, read closed, but in some parts of this city it hasn't felt as if it's been closed. We found a busy, bustling high street in one of the areas that's seen the most number of positive test results in recent weeks. One businessman said to me that the lockdown isn't being policed and so it isn't being taken seriously. And yet in the same area, people were queuing in their cars bumper to bumper waiting to get tested. And that difference has caused some unease. There's been a lack of official information about why this new lockdown was needed. And in that vacuum, rumours and accusations have started to spread. The South Asian community in particular have found themselves under scrutiny as people ask why this outbreak has flared up again in this city.
Leicester in lockdown. Although it didn't quite feel like that today in the east of the city.
It's normal. I don't feel anything close here.
It's not supposed to be normal after last night's announcement telling people once again to stay at home.
It's not being policed, and if it was being policed, I think people would take it a little bit more seriously.
Mohsin Seth is a business owner who says most people here are wondering how they can make a living now that lockdown has been extended.
So it's all well and good telling people to stay at home, but how do they make their ends meet? That's what obviously a concern for a lot of people, and I think that's where we find a struggle to get that balance.
This is Spinney Hill, an area that's seen the third highest number of coronavirus cases in the last 2 weeks. During that time, this community has come under scrutiny, and it's leading to unease. There have been several rumours and accusations circulating here about the source of the outbreak. Many are unfounded, but they're causing huge concern. One example, as we've been filming, several people have come up to me and said that there's one house here with 45 residents, all of whom have COVID-19. Now, the authorities say it's unlikely that this is true, but it's gaining traction on social media. Leicester has the largest amount of garment workers in the UK, with around 800 factories employing thousands of people. We've been told of at least 8 that have had to close down due to outbreaks of COVID. This woman saw us filming and came to tell me that one of her relatives had been employed in a factory she believes was open when it shouldn't have been. She worried workers were poorly paid and packed inside without any social distancing. In the past, conditions in some factories have been described as a source of national shame, with some workers said to be trapped in modern slavery. The MP for North West Leicestershire has linked conditions in some of these factories directly to the outbreak.
The elephant in the room that no one's talking about is the predominance of sweatshops in Leicester East, which have worked in breach of the lockdown, if my information is correct. Throughout the lockdown period, you've got poor working conditions, cramped housing, and that's why I believe you've got a huge spike in the constituency of Leicester East.
But the Director of Public Health in Leicester told us today that clothing factories aren't thought to be the main source of the outbreak. We went to see if we could talk to some of those who are still open. They're still working during lockdown, though?
Oh, yeah. So, but we keep social distancing. When bus comes, you can come in.
They didn't want to say any more on camera. OK, all right, thank you. Inside this building, we found several different factories operating side by side. Some of the workers told us they had closed back in March, but reopened 2 weeks ago when lockdown was eased. Yeah. Saeed Khilji is chair of the city's Textile Manufacturers Association. He denied accusations that illegal factories are operating in the city.
Well, I don't agree with that, because I'm not aware of any sweatshop here. We used to have all these problems before, and we cleared that problems.
Public health officials have told us that their greatest concern in fighting this new outbreak is community transmissions. They've urged everyone in Leicester to follow the guidelines and stay indoors.
Well, joining us now is Dr. Manish Parikh, who's an Associate Professor of Infectious Diseases at the University of Leicester and a consultant at Leicester Royal Infirmary. Since the outbreak of the pandemic, he's been researching the very impact of ethnicity on how people recover from COVID-19. And does the fact that there is a very large ethnic population in Leicester explain in part why there's such a problem?
So the areas of the city that have been affected, East Leicester has been said, are areas of inner city Leicester with high levels of ethnicity, but also pockets of deprivation, crowded housing, and also multi-generational households, including multi-occupancy households. So when you take all of those things together, you've got a perfect storm to drive a viral pandemic.
Do you think, therefore, that it's possibly unique to Leicester because of the nature of the way the population is spread, or is there some other additional explanation?
So we know that individuals of certain ethnic groups, particularly those from South Asian and Black ethnic groups, are at increased risk of COVID-19, both being infected but also, unfortunately, going on to intensive care, and also slightly increased risk of death. But also deprivation and other factors are associated with this. What I think we aren't entirely clear yet is what's driving the viral pandemic, whether it's household transmission or is it transmission out of the household in employment settings.
And have they locked down quick enough? Should this have happened, you know, a week ago or whatever?
So fundamentally, the virus hasn't changed. It remains with us, and we know that from all the briefings that we've had. Lockdown essentially reduces the risk of individuals having contact, so therefore reduce the risk of transmission. But what's important to remember is a couple of things. If we have a group of individuals living in East Leicester who continue to work in social care, healthcare, taxi drivers, bus drivers, those individuals will continue to be working in those sectors. So a lockdown, perhaps on its own, isn't going to have the impact that you wish. So and if we think about the first lockdown, it hasn't necessarily shown the impact that perhaps we would have wanted. So I think there is a need for additional action that's required now in terms of active case finding, contact tracing, very extensive contact tracing, and also public health messaging in those local communities, working with the community leaders and the local populations.
There's no reason, therefore, to believe that Leicester will be alone. There will be other cities, probably, that are going to suffer what's going on in Leicester.
Leicester won't be unique. We have an inner city population which is very similar to other major conurbations, major cities, and therefore what we are experiencing is likely to be experienced by others. Therefore, some of the lessons that we learn as this second spike is starting to be action against this second spike needs to be taken into account by other sectors. So the issues around deprivation, household size, crowded housing, they all exist in many areas of the UK. So I don't expect this to be the first spike that we see.
Dr. Parikh, thank you very much indeed for joining us. Thank you.